Just one day after the Cleveland Police Department established a partnership with mental health professionals, they put it to good use, helping a man who had made a threat. The volunteer behavioral health care system is partnering with police departments to ensure those dealing with mental health get help. Dallas Payton has the story.
Recently, the Volunteer Behavioral Healthcare System was awarded a grant to place multiple correspondents and law enforcement agencies in Middle and East Tennessee. Cleveland and Chattanooga were one of them. Out of 30+ counties, they were determined to have one of the highest call rates for mental health. Officer Nathan Hartwig and Luke Hanna will be the co-responders for the Cleveland Police Department. Kelsey Taylor with Volunteer Behavioral Health says they'll provide risk assessments at the scenes they are called to.
Determine if the person is suicidal, homicidal, psychotic, determine if their depression is so severe that they're not addressing their needs, they're not bathing, they're not showering, they're not eating, really determining what level of care someone needs, whether that's outpatient, whether that's A&D treatment, alcohol and drug, whether that's, inpatient hospitalization.
They will only enter a scene once it is declared safe. Officer Hartwig says this will bring much needed relief to police officers.
We're already seeing that just in the last few days where patrol is responding to calls, and then they'll see that it's a person in crisis and they'll call us out and we can relieve them, so then they can go answer other calls as well. So it's a win-win situation for everybody.
It'll also allow people with mental health issues to get the right help instead of just being thrown in jail.
It's been needed because we need to be able to approach some people that are having a crisis in a different way, and not always in a criminal aspect.
The department is averaging 3 to 4 calls a day that require mental health assistance since launching the program. If there's an incident while a co-responder isn't on duty, officers can still get assistance.
Volunteer Behavioral Health also has a 24/7 mobile crisis team. So when Luke's not on shift, the department can call them and they can respond out. If it's not an immediate threat if the person's not an immediate threat to themselves or others, Cleveland has an after-hours referral form that other officers can fill out and send to Luke and Hartwig.
In Cleveland, Dallas Payton, Local 3 News.